are committed to creating and sharing knowledge that empowers children and young people to understand the steps they can take to reduce their risks, increase their resilience to mental health problems, and improve their mental health.
Our vision is to create a world with a sound mental health for all.
Greetings to you all. Welcome to our show, Tap In.
In my view, I think conflict is when there is disagreement. It can be about something productive or constructive, or it can be about something that you may view as trivial, but still when there's disagreement, I think we can say that there's conflict.
Okay, yeah, Charlene.
So true. It's incompatibility, as you have just said, in values, in interests, in goals between two people, groups, and in the case that we're looking at today, incompatibility between adolescents and their parents.
Hello everyone, welcome to our show Tap In. Thank you for watching the just ended series Parent-Adolescent Relationship. This week we are beginning a new series called Substance Abuse. Why is substance abuse? In Zimbabwe at the moment, we are having two big problems. First one is COVID-19. Guys, COVID-19 is real. Let us mask up, let us follow the WHO, the World Organization regulations, let us social distance, let us avoid unnecessary movement. Again, on substance abuse is real. People are taking drugs for so many reasons. Some, they just want to run away from their problems. Some, they just want to take drugs so that they can enjoy it. Some, they just want to take drugs because they don't know the effects. They don't know much about the substance abuse. So we need to come together as the nation to fight these two problems that we are facing, COVID-19 and substance abuse. So today, we are starting with this week we are starting with the overview of substance abuse. So today we have our guests in the studio. I will allow our guests to introduce themselves. So guys, can you introduce yourself?
Hello, and thank you for having me, Mr. Mrepa. My name is Tanyara Dzwangseura, and I'm an intern community psychologist practicing here in Zimbabwe, in Weru, the Midlands province.
Okay, thank you, Tanyara, for having us on our show.
Thank you.
Thank you so much, Mr. Mrepa, for having me. My name is Prinsley von Boscha. I'm the chairperson and the founder of the Vonru Foundation, as well as the chair of the Digital Hub, which is the Digital Innovation Technology Hub. It's a young budding company that's growing in the tech industry. Yeah, it's basically about me. Thank you.
Thank you so much, Mr. Von. Okay, so to begin, what is substance abuse? Starting from you, Tanya, what is substance abuse? What do you understand when we talk of substance abuse?
Okay, when we are talking of substance abuse, Mr. Mrepa, we are talking of the use of alcohol and other prescription medication and other illegal substances in a wrong way and taking them in excess amounts that would impair our judgment or our reasoning or our functioning.
Okay, Mr. Von, what do you think? What do you understand about substance abuse?
Drug abuse is whereby one usually ends up abusing the proxy of medication that they must be taking, and they now use it or use that same drug for other reasons that are not for medical purposes, or when one takes certain kind of drugs so as for them to be high or anything, and use it not for the prescribed medical reasons. Yeah, that becomes drug abuse. Or when one takes some form of drugs, maybe for enjoyment or for leisure purposes or things like that, but then the outside of the scope of the medicinal approved cycles, that becomes drug abuse. Back to you, Mr. Mreva.
Okay, so from your definitions, you highlighted that substance abuse is when someone is using something that is not prescribed for. Is it okay? Is it someone that is not?
Yes, I agree with you there. It's taking medication or drugs which are illegal, or they will be prescribed, but they are taking them in excess.
Okay, thank you. Okay, can you also classify now the different types of substance abuse?
Okay, when it comes to drugs or substances that can be abused, they fall under a lot of classes. We have narcotics, we have hallucinogens, we have depressants, we have alcohol standing on its own. We have depressants, I mentioned those. Then with all these classes, the drugs fall under the different classes that we have. We find people nowadays, especially in Zimbabwe, they take solvents. Solvents, they can come in liquid form, or they are there for them. They send messages to both the brain and the body. So we have people who take solvents. We find now we have young men and women these days, they are dissolving the diaper, the liquid in the diaper. They want it to become sort of like a solvent. And we have depressants. These can be drugs that can be prescribed by a doctor or a psychiatrist for someone going through depression. And young people, or even nowadays, people abuse those depressants. In Zimbabwe, commonly people take CPZ, which is got the slang name. They call it Maragada, and they will be using those drugs, those antidepressants, as drugs for them to get high. We have narcotics, which young people also take in Zimbabwe. And we have other drugs like Anaguka and a Blue Diamond. Those are prescription medication, which people are taking in excess so that they can have that feeling of being high or increasing their happy state, so to say. Over to you, Mr. Mrepa. I could go.
Okay, Mr. Von, do you have any classification or type of drug to add on from what you just mentioned?
Okay. She actually gave quite an elaborative, explanation. Personally, I'll just say, even painkillers, if you take painkillers the wrong way, that becomes drug abuse. If you take medicine that you're supposed to be using on a daily basis, you're supposed to be taking in maybe 2 pills, and then you end up taking 5 pills for the purposes of being high or whatever reasons that may be, that becomes drug abuse. So in layman's terms, drug abuse is taking anything beyond the prescribed measurement, whether it be legal or not legal. As long as, even if it's the legal one, you take it beyond the prescription measurement, that becomes a drug abuse.
Okay, thank you. Just to add on, maybe we also have hallucinogenic as a type or as a classification of substance abuse. Do we have any examples of these hallucinogenic drugs? Back to you, Tanya.
Right, maybe I would say hallucinogens. Those are the drugs that alter the thinking process. So for hallucinogens, we have those kind of drugs that alter the image and the hearing. A person ends up having hallucinations. We have most of these that are coming in today with the slang name. They call it Buka Mtoriro, or they have a crystal meth that they are crushing and putting inside muffins or cakes. Then they eat them, but the inside is the hallucinogen, which will now cause them to have that blurred vision, start to have hallucinations, and start to say they're hearing things or seeing things. Over to you, Mr. Mrepa.
Okay, so now let's talk about the risk factors. What are the risk factors, or what are the causes that someone would want to use substance abuse? Starting with Mr. Von.
So
Okay, thank you so much for that. So in terms of the reasons why or the risk factors of drug abuse, there are quite a number of risk factors. And you must appreciate the fact that sometimes drug abuse is not something that the abuser gets to invent on his own. Probably it's because of the history of the family. It's about the genetics. If you were born to a person who was a drug abuser, by genetic you are bound to to follow that same sequence and things like that. And also if you're coming from a family that's abusing drugs, maybe you are a 14-year-old, or you even a 21-year-old, and then your parents or your big brothers or whoever you look up to within the family, they are abusing they're into drugs and abusing drug abuse and things like that. By in a de facto mode, you are also prone to end up abusing the drugs and things like that. And also, if you are to look at the things like depression, those are some of the major drivers or the risk factors that are getting young people hooked up on drugs and things like that. So there are a number of things that have that are coming into play in terms of influencing drug abuse, or if you may want to call them the risk factors. The issues to do with the social and economic political situation of our country, that on its own can also propel young people to get into drug abuse. So yeah, it's quite a huge array. It's a very big spectrum to say that the people to get into drug abuse. So yeah, it's quite a very huge area, and we can't say that these are the specific ones, but each and every little thing should be treated with utmost caution and an appreciation that it is a huge and major impact. So you can't say family history is the more the risk factor that's going to make young people get into drug abuse and things like that. And then this one is minimal, this one is huge. Everything should be treated as if it's with consequences, with a consequence impact on the issue of drug abuse.
Okay, thank you, Mr. Von. You highlighted the issue to do with modeling young people learn or see from family members, and also the issue of genetics. You also highlighted the issue of depression. Someone takes substance abuse so that they want to run away from their mental problems. Okay, back to you, Tanya. Do you have any other risk factors to add on?
Adverse childhood experiences, or ACEs. There are a number of research studies being conducted now, and what were also conducted before, which shows that there is a very strong positive relationship between adverse childhood experiences and drug abuse, because we find most people who are using substances or drugs have also been victims of adverse childhood experiences when they were growing up.
Okay. Okay, thank you for highlighting that one. So we also back to family. It's all about family as the risk factors. Okay, what about poverty? Don't you think poverty is also another risk factors for someone to take substance abuse?
It is, Mr. Murepa, it is, as Mr. Vaughan was saying about the socio-economic challenges that can propel a person to start, getting into drugs because of the pressures and the depression that they have with them. And also, we speak of COVID-19 today. It's one of the reasons why some people are getting into drug and substance abuse, because they are failing to cope with the new normal that we have in this world today.
Yeah, okay, thank you for highlighting that one. Yes, young people are taking substance abuse because they are failing to cope with the new normal and the pressure that COVID-19 is bringing to our life. So, Mr. Vaughan, do you have anything to add?
Poverty has a very, very huge bearing in terms of how everything gets to be structured. Like what the wonderful Memi is saying, that poverty can push you into things that you didn't do. It's if poverty can push one into criminal activities, then for them to get the guts to do all those things, it has to be drug abuse. Look at the people who abuse drugs mainly. You will see that those are the same people that are living beneath the poverty datum line, not just in Zimbabwe, but everywhere across the world. So poverty is a huge risk factor that's propelling young people into drugs. Not only young people, even the old-aged people. So long as you are poor, people try to run away from their everyday responsibilities or things that they should be doing. So they end up finding a safety net in drugs, and then eventually they'll end up getting into the substance and drug abuse.
Okay, thank you so much for highlighting that one. And also, now to conclude, do you have anything to add on, so that our viewers would learn from you, like your how best now can we say we are concluding this show? Do you have any other ways to say or to talk about substance abuse as an overview, starting from you, Tanya?
Maybe as an overview with what we've been discussing before, it's you'll find the drugs that could be used in Zimbabwe today would obviously be different from the drugs that are going to be used in America and UK. It's different across the globe. So we have to we have to have solutions that are context specific, because nowadays we are talking of some things we never thought could be substances that can be abused and lead people to serious consequences. For example, we hear of Jolly juice powder, which is being abused by young children in primary school. We have diapers that are being used as substances. We never thought of that maybe 10 years ago. We're talking of only mbanje. So whenever we're going to frame solutions to end substance abuse, we must also they should be context specific.
Okay, thank you for highlighting that one. There should be concept. You should know the area that you are dealing with, so that we might come up with a good approach to that area. Okay, Mr. Von, do you have anything to add on as an overview for substance abuse?
Okay, thank you so much for that. Thank you, Tanya. I think she summed up basically most of the things that I would have also said. But maybe just to say that we mustn't treat drug abusers as isolated cases, or we mustn't stigmatize them, because some of them, of course, it will be a choice to get into it, or it could be a compelling choice. Maybe they're compelled by certain circumstances and everything, but then it becomes the burden of a whole society as to help those people out of drug abuse, because drug abusers by extension, or by far and large, they wreak havoc not only to themselves, but also even to the next people or to the community that they are living in. So it becomes a community burden for them to reel those people in, and as well as to win them off from the issues of drugs. So we must engage in a collective effort if we are to curb the issue of drug and substance abuse. And we mustn't stigmatize or isolate those people that are abusing the drugs, but rather we must find ways and mechanisms to win them over, so that we can get them off the drug and substance abuse. Thank you
so much, our guest, for sharing with us your knowledge and your knowledge about substance abuse. Thank you so much for having us on our show. Thank you, Tanya.
Thank you,
Tanya. Okay. Thank you, Mr. Von, for having us on our show.
Thank you so much, sir, for having me. It's been a pleasure.
Okay, thank you. To our viewers, you just learned from our guest today. Substance abuse is a real issue. It's a real problem that we are facing as a nation, and we need to deal with it in a manner that allows everyone to participate. We should not discriminate. We should by all means to make sure that we treat each other in a way that is friendly, because some of those people are there not because they want, but are there because they have some other problems that they are facing in their daily life. Thank you for watching the show. Thank you for watching Tap In. Watch us next week as we discuss about substance abuse disorders.